Canada's vaccination rates are among the best in the world, with very low hospitalization numbers and a population that is anxious to return to more normal lives. Everyone understands that getting back to normal will be a long and challenging road. But Canadians tell us they are eager to travel, and Canadian tourism businesses are ready to welcome the world back to Canada.
Well, with March break right around the corner, there are growing calls to lift COVID-19 testing requirements when it comes to returning from international destinations by plane. As it stands right now, Canadians returning from any other country, including the U.S., are required to have a negative PCR test within 72 hours of boarding an incoming flight. They can fly back without testing if they have proof of a positive COVID test taken 11 to 180 days before returning.
According to recent data from the Ontario Science Table, more than 1 million Ontario residents have contracted COVID-19 since December 1st, but only a small percentage of those infected had access to a PCR test at the time to prove it. This could cause some major challenges for some planning a trip in the near future. That's why some are calling for an end to Canada's travel testing requirements, calling them obsolete. With more, we're joined by Andy Gibbons, VP of Government Relations and Regulatory Affairs at WestJet. We're also joined by Dr. Zain Chagla, an infectious diseases physician with St. Joseph's Healthcare in Hamilton, along with Susie Grynol, President and CEO of the Hotel Association of Canada. Thank you all for joining us tonight. Dr. Chagla, to you first. Do you think the federal government should remove, or at least have a specific timeline for removing the 72-hour PCR testing requirement?
Yeah, absolutely. Look, number one, this is a huge expense. Travelers are paying hundreds to thousands of dollars in order to actually come to Canada when they're in their destinations. They're really at the behest of whatever the agencies or labs charge in those countries. Number two, we're paying hundreds of millions of dollars to support this system in Canada, which is taxpayer-funded money. And number three, you documented it well. The credible estimates of how many people got infected in the last 2 months, somewhere between 1.5 to 4 million people. That's up to 30% of our population that had COVID. That means their tests can be positive for weeks to months. Doesn't mean they're infectious. But when they travel, and if they haven't documented their positive PCR, which many have not had access to testing, they may test positive in their destination, which means that they have to isolate in a foreign country, they have to cancel and rebook flights, they may be separated from family, they may have to undergo whatever public health restrictions are in place in that country in order to quarantine. And with no benefit, these people are actually being harmed by the testing more than anything else. So, I think with all of those things, we really do have to put a timeline to stop doing PCR testing. And again, with the numbers that we've had more recently through this Omicron wave, it really does have to happen sooner rather than later for the ability to cause harm to people.
Doctor, just to be a little more specific, what do you think that timeline should be as a doctor?
Yeah, sooner rather than later. We don't want people stranded. We don't want people paying thousands of dollars. We don't want, us as taxpayers paying hundreds of millions of dollars for testing at the airport, where it could be very well used in jail, shelters, Indigenous communities, long-term care facilities, a number of places where testing is badly needed with good turnaround time. So, I would say tomorrow, the evidence is not going to change on this. In fact, more people will get infected by the day, which makes this testing even more useless as time goes on and really, causing more problems for travelers being stuck abroad.
Andy, on that note, there have been rumblings about this, that potentially the federal government is considering this ask by industry partners like yourself, like WestJet. Have you had any conversations with the transport minister?
We've had good conversations with the government since the start of COVID. We work with them very closely to implement a vaccination mandate, which means that everyone who gets on our aircraft is fully vaccinated. And we're actually the only fully vaccinated aviation sector in the entire world. So there's a good safety and health basis for us to move forward and implement some of those things that the doctor has spoken about. We hope that they'll be making announcements soon. Certainly, if you look at what other countries have done around the world, Canada is a little bit behind, but I'm sure they want to take their time and get it right. And we're expecting some announcements from them in the near term, because there seems to be a consensus around this that hasn't existed throughout COVID. And you're seeing physicians like Dr. Chagla and others really, there's a strong consensus that hasn't always been the case throughout COVID. And I think that's important. That's important for the government to feel comfortable moving forward.
Andy, how does this impact, the flight schedule on behalf of WestJet? And can you elaborate in terms of your workforce? Just a few days ago, layoffs were announced. This is an industry that we've talked about this so much has been suffering now for 2 years.
It's been very difficult for our company. There's no question about it. We didn't announce layoffs. We did announce that for the month of March, we would be reducing our flights by 20%.
Oh, I'm sorry.
And that's,
okay.
that's just an unfortunate last resort decision. And at the end of those cancellations are communities who want to be connected economically, and so their citizens want to go on a much needed vacation. So, we unfortunately had to make that decision. We hope if the government moves quickly enough that March is the last month that we have to do that, and that we can see a strong spring and a strong summer and Canadians traveling safely.
Thank you for clarifying that. Not to mention still the travel advisory to avoid all non-essential travel is in place. So, I mean, while people can go, it looks like in many cases they aren't going. Mark, go ahead.
Yeah, Susie, I wanted to bring you in and ask you kind of how this is all impacting the hotel industry here at home in Canada, especially when it comes to testing and people staying in hotels here.
Yeah, so our travel industry, our hotel industry, and the broader tourism industry here in Canada has been absolutely devastated. It's been 22 months of sustained revenue loss. We've lost 2 critical summers, and we've really got our sights set on this summer. And what's important and to note is that today is the booking window for this summer for our international customers, our best customers who come to Canada, who stay 7 times as long, who spend 5 times as much. We are hanging on by a thread. And so if there's no scientific basis to continue having these restrictions at the border, which are daily preventing people from making the decision to come to Canada, we're absolutely asking for the government to announce an immediate plan to reopen our border and remove some of that stickiness effect so that we can have the summer that this industry so desperately needs.
Dr. Chagla, what about the randomized testing that's happening at Pearson upon arrival? Do you think this should remain in place? I know if you are picked, you have to go home and isolate till you wait for your results. That could be 24 hours, if not longer. It's one piece of this testing puzzle that's in place here in Canada.
Yeah, absolutely. I mean, that's another piece that we really do need to reconsider. I mean, I think people make the excuse that this is for surveillance, for variants, to see what's coming in over the country. But I think we have to realize if the turnaround times aren't fast on this, if they're 7 to 10 days, someone's past their period of isolation, quarantine. In many jurisdictions, they'd be allowed to go back into society if they had COVID, on day 1 when they returned. And I think the other part is, again, there are better ways to look for variants. There's sequencing capacity, there's wastewater surveillance. A traveler who develops symptoms in their own communities after their travel doesn't have access to a test in many communities. And I would argue that's probably a bigger bang for the buck to be able to survey for variants of concern and what's coming in over the border. So, I think there's ways to realign this into the communities and away from the airport. You can certainly do anonymous testing in the airport that doesn't require a quarantine period, so people aren't feeling like if they get randomly tested, their work trip or family visit is completely screwed. I think that there's a lot to do that there in terms of really optimizing this testing rather than taking it out on travelers.
Dr. Chagla, in terms of those who test positive with COVID-19 based on travel, when we look at the numbers, the data put out by the Canadian government, what's posted today is that less than 1% of those who traveled outside of Canada test positive for COVID-19. Now, I want to point out almost 23%, there's information that's unknown. Those could be included in part of the group that travel. But throughout the pandemic, when I've checked this number, it's always below 2%. Has it been really necessary at any point to have these restrictions in place, the mass testing, and then the impact that we see on the travel and tourism industry? More recently, let's say, in terms of the pandemic.
I think you could make the argument early, right? When vaccines weren't here, when all we had was public health measures that were trying to control disease in our community, when we had control, we didn't want to introduce a lot over the border. And so that's where the restrictions came in place. But now we have, one of the highest vaccine rates in the world. We're getting third doses out to people. Our hospitalizations are coming down. Our cases are coming down in many of our communities. I think, again, the epidemiology of what happened with Omicron really put us on the same stage as the rest of the world. And so, again, is there a risk of acquiring COVID with travel? Absolutely. Is there a risk of me acquiring COVID going to a restaurant or going to the grocery store? Absolutely. And I think when these two things even out, it really becomes difficult to justify border restrictions when, again, there's inherent risk with people just engaging with society on Canadian soil.
Mm-hmm. And Susie, I know you already spoke a little bit about people making plans for their summer vacations, but what kind of impacts are you seeing with these regulations when it comes to March break travel plans here in Canada?
Yeah, we're seeing cancellations by the minute. I mean, we lost our Christmas season, we lost the ski season. Effectively, the spring season's been wiped out, and this is really why we've got our sights set on the summer. I think we are, as I said, we're hanging on by a thread, and I think people are just, Canadians follow the rules. International visitors follow the rules, and really the signal that Canada is sending right now is that it's not open for business. And so people are making the travel decisions every day, every minute. We are losing cancellations because people are choosing other countries that are open.
Yeah, it has been so challenging. And like Andy said, there has been some positive conversations with the government here in Ontario. The Premier, according to our sources, is asking for the potential for a speedier reopening. So it looks like this could be imminent. As Dr. Chagla says, it could happen now. So thank you so much, Susie, Andy, Dr. Chagla. We appreciate your time tonight.
Thank you so much.